Tales from an Urban Multipurpose Trail, 1.5 miles of wellness, presented to the 3rd International Conference on Health, Wellness, and Society, March 15th through the 16th, 2013. Presenters and researchers are Dr. Saul Sanders, Department of Health Professions, Dr. Nicole Mellons, Department of Human Performance and Exercise Science, and myself, Mr. Mark Zetz, Department of Human Ecology. We're from Youngstown State University in Ohio in the United States of America. Mill Creek Metro Parks is located in Mahoning County in Ohio. This beautiful property has over 25 trails available, and we focused on the East Gulf Hike-Bike Trail for our research. Mill Creek Metro Park's East Gulf Hike-Bike Trail inspired many research questions and observations. This research was produced in collaboration with park personnel. During this time, Mr. Tom Bresco was the interim executive director, and Mr. Clark Johnson was the executive director of the Mill Creek Metro Park system. The 1.5-mile paved surface used for pedestrians features restrooms, water fountains for both pets and owners, mileage markers, and parking areas. The multi-purpose trail has many uses. The most popular is walking, followed by jogging and running, bicycling, inline skating, and in the winter time, cross-country skiing. Physical activity is important, as our research shows published reports on the benefit of physical activity through the Center of Disease Control and Prevention, American College of Sports Medicine, the Office of the U.S. Surgeon General, and from the 2008 Physical Activity Guidelines for Americans, stated adults should strive to accumulate at least 30 minutes of moderate intensity physical activity most days of the week. And our trail certainly provides that environment. The environment is important to physical activity. In the report Healthy People 2020, advocates for multidisciplinary approach to promoting physical activities pointed out the positive effects of the use of sidewalks, bike lanes, trails, and parks for pedestrian use. Prior research has associated increased physical activity with the availability of parks, trails, bike lanes, and the proximity to people's location, the aesthetics of the area, and its safety.
Thank you, Mark. Hi, I'm Sal Sanders, and I have the privilege of speaking with you about our research methods, results, discussions, and some of the implications of our research findings as we continue on in this presentation. When thinking about the obesity rates and the number of overweight people in the United States, sometimes it's easy to lose sight of the fact that there are people out there engaged in healthy behaviors. As researchers, we noticed people along this 1.5-mile stretch of trail engaged in physical activity, walking, jogging, cycling, exercising their pets, and we wanted to learn more about them and some of the reasons they were out there on the trail. So the purpose of our research was to explore the health, fitness, and wellness-related uses of the trail and to describe the characteristics of those who were utilizing it. Our research questions reflect the exploratory nature of our project. They are: what characteristics describe those who use the trail? To what extent does the trail serve their fitness and wellness purposes? And finally, does trail use vary according to seasons? And by seasons in this case we mean spring, summer, winter, and fall. We designed our own survey instrument. It was pilot tested with people that we felt had the same characteristics as those we would meet out on the trail, and then revised for clarity. We wanted to address the specific research questions that we just talked about, as well as to gain information of interest to the park's executive director and management team. In addition, we sought to obtain information about the demographics or characteristics of those using the trail, their perception of the trail's importance to achieving their health and wellness goals, their health habits, and the participants' actual use of the trail. What types of activities were they engaged in while they were using the trail? We also wanted to determine health, fitness, and wellness benefits that they felt that they derived from their trail use, as recommendations they might have to improve the trail. Data collection took place on the East Golf Hike Bike Trail and Mill Creek Metro Parks, with members of our survey team situated at both the north and south access points to the trail. The surveys were conducted several hours during the morning, afternoon, and early evening on the days that we were conducting the survey, and we conducted the survey during the spring, summer, and fall seasons. We had multiple ways for participants to complete the survey or have their results recorded for them. They could read the questions and write down their own answers. They could have the questions read to them and the responses written down by a member of the survey team, or they could have the questions read to them and use a digital audio recorder to record their responses. We provided these multiple ways to respond because we felt that some people may not have their corrective lenses with them, or because of the exertion during their workout may not feel like recording and writing any lengthy responses. So we tried to provide a variety of ways that people could respond to the survey. And the data was collected without identifiers. However, given the local nature of the research project, some of the participants may have been known to some members of the survey team. So on to the fun part. Let's see who was out there. Our participants consisted of 596 adults. We did have a couple of people who were under our age requirement, and their surveys were not included in the results. Our participants ranged in age from 18 to 89 years of age. The majority of them, at 59%, were female. The majority of them were also college graduates, with another at 63.6%, with another 21.6% having some college education. So a fairly highly educated group completed these surveys. And as far as race and ethnicity, the two top groups were Caucasians at 87.4%, followed by African American at 6.4%. Some other characteristics of our participants: the majority of them were employed full-time at 52%, while almost 27% indicated that they were retired. Their annual income ranged from $10,000 to more than $70,000. 60% of our participants traveled 10 minutes or less to arrive at the trail, while approximately 9% of the respondents were willing to travel more than 30 minutes to get there. More than 90% of the participants perceived the trail as being safe or very safe while they were engaged in their activities there. 4 visits in a typical week was the most common response or frequency for trail visits, and visits ranged from 1 to 14 visits per week, indicating that some participants utilized the trail more than once during a single day. When they were on the trail, most people engaged in activity for about 1 hour on average, and this ranged from 15 to 220 minutes among our participants. We asked people to identify the different seasons that they utilized the trail. Summer was the most frequently selected, followed by spring, fall, and winter was the least most frequently indicated season of use by our participants. Walking was the activity most often reported when participants were asked to select all of the activities they engaged in while at the East Gulf Hike and Bike Trail. This was followed, walking at 82% of the participants selected walking, followed by jogging at 45%, cycling at 33%, pet exercising at a notable 23%. And then from there, inline skating and skiing, cross-country skiing, and other activities were selected less often. We also asked participants when they were engaged in these activities if they were by themselves or with a group, and they were slightly with a group more often than by themselves, at 64% with a group and 61% indicating that they exercised by themselves or engaged in activities by themselves most often. Other findings of note here: the largest group reported consisted of 20 people, and 19% of the participants reported bringing one or more pets to the trail, though most brought only one pet. The most pets indicated on the survey was 20, indicated by one of the participants. One of the participants indicated they brought 20 pets to the trail. We asked participants to report all the fitness and wellness purposes that the trail serves for them. Kind of get an idea of why are they out there. The results on the next two slides can be viewed as a ranking from the purpose most frequently indicated, which was to improve physical fitness, to the least often indicated, which was to consult or obtain advice from others, which will appear on the next slide. As you can see, losing weight, enjoying and experiencing nature, managing stress, and relaxing were all frequently selected as purposes that the trail serves. And along this slide, again, the least often selected was to consult or obtain advice from others. We asked participants in the study to comment on fitness and wellness purposes that the trail served for them. And then we analyzed these comments that we received back from them to look for evidence of the 6 dimensions of wellness. And we found all 6 dimensions were represented in the responses from our participants. Most responses connoted the physical dimension at 46%, followed by the emotional, environmental, mental and intellectual, social, and spiritual dimensions. The role that the trail plays in helping participants achieve a fitness, wellness-related goal or purpose. The majority of participants indicated that the trail played a very important role. In fact, 95% of the respondents indicated that the trail was playing a very important or an important role in meeting their fitness, wellness-related goals or purposes. We requested that participants provide recommendations for improvements that could be made to the trail. And a number of the comments were that everything's just great, keep it as it is. But there were folks who did provide some recommendations, and we went through and compared them and identified some common themes here, such as providing additions. 54% of the participants wanted something new added to the trail for an improvement. These included things such as lighting and adding a restroom. And it should be noted that there are restrooms on both the north and south end of the trail. There were some folks who would like another restroom around the midpoint of the trail. Another category was improving enforcement of current rules and controls, and 15.5% of the comments reflected this recommendation. And there are already rules about some of these things, but people wanted them to be enforced maybe more rigorously or more consistently. One of the respondents said the ticket cars that were taking up too many parking spaces, and to enforce rules about picking up after people's pets. Improving maintenance was another area for improvement, and this consisted of comments such as plowing the snow in the wintertime. Making structural changes. Some comments here included providing a separate lane for bicyclists and maybe extending the trail, making it longer. Adding rules and controls, So not just enforcing the current rules and controls, but adding some new ones was specified by 5.8% of the comments. And these reflected things such as having pedestrians move to one side so that the bikes could have, I guess, what is in effect an easier way to pass, and also to extend the hours to nighttime use. And finally, preserving the natural environment. And comments here reflected things such as keep it natural and keep it beautiful. It should be noted that this is the first look at the demographics and characteristics of people engaged in activities along the East Gulf Hike Bike Trail in Mill Creek Park. The demographics of the trail users indicate that the survey population differed markedly from that of the overall population in the Youngstown area. Respondents to our survey, those trail users, were more likely to be Caucasian. In fact, 87% of them were. They were more likely to be female, and they were more likely to possess a bachelor's degree or higher than were people in the Youngstown area. The respondents in the survey were also less likely to be unemployed. Their unemployment reported at 7.9%, whereas the unemployment rate for the Youngstown area at the time was roughly 11%. 73% of respondents reported a net annual income greater than $30,000, whereas the median annual revenue for Youngstown area residents was reported at $24,000. It's important to note that the findings of this research support the importance of the trail in users' maintenance of wellness, and in particular, of providing a venue for them to engage in physical activity and help maintain a healthy body weight, which are key objectives for improving Americans' health. Some participants attributed significant weight loss to their use of the trail. One participant, who described using the trail 6 days a week, revealed a loss of 100 pounds over a year's time and described several other health improvements. We also found that trail use varied according to the seasons, in answer to one of our research questions. There were some limitations to our research methods. Our sampling method was purposive and convenient, and because of this, the data reflect only the perception of participants using the East Gulf Hike Bike Trail. The findings reflected in this report may not generalize to users of other trails within the Mill Creek Metro Park system, so we would recommend surveying users of other trails within the Mill Creek Metro Park system. Another limitation is that the data is self-reported. Self-reported data allows for potential inaccuracies due to things such as selective memory, selective reporting, social desirability, and strength of motivation to participate. It's also possible that participants may have exaggerated their responses if they felt that the trail were in jeopardy if the results weren't positive. Another limitation is that only people actually utilizing the trail were surveyed, and even of those were given the opportunity to participate in the survey, and even of those, we don't have the perceptions of the people who chose not to complete a survey or who don't utilize the trail. So what are the implications of our findings? We believe that these findings will be of interest to those planning, creating, or maintaining multipurpose trail facilities. The findings provide usage and activity data that can be useful for planning and support by park administrators. The results also provide specific recommendations for the Park District to improve and maintain the East Gulf Hike and Bike Trail. The results of this study have been utilized in strategic planning by the Mill Creek Metro Parks District. The results of this study will also be of value to those interested in fitness and wellness promotion and public health. The results support the importance of the East Gulf Hike Bike Trail in helping study participants achieve health and wellness objectives. They also describe the characteristics of people engaged in healthy behaviors at an urban multipurpose trail. We wish to thank Mr. Tom Bresco, who served as the interim executive director, and Mr. Clark Johnson, who was the executive director of Mill Creek Metro Parks at the time of our study, for their support of our research project. This project was funded in part by a research grant from the Batante College of Health and Human Services at Youngstown State University. Thank you for sharing your time with us. If you would like more detail than we were able to provide in this brief presentation, please consider accessing our article, which has been accepted for publication in the International Journal of Health, Wellness, and Society. We wish you good health.